Welcome to MumAbroad's YouTube channel. I'm joined today by Dr. Ken Jennings. He's a registered psychologist, started a private practice in Johannesburg in 1986. He's had a varied career in the fields of education, sport, and psychology. Ken says of himself, "I am a systems-oriented process thinker and work towards creating possibilities for others." The central theme in his work as a psychologist has to do with achievement and getting others to fulfill their potential. In 2015, he relocated to Germany with his Croatian wife to be closer to his son and grandchildren, and he now works exclusively online. Hi, Ken.
Morning, Jane. Morning.
How are you today?
Fine, thank you, and thank you very much for the invite.
My pleasure. Ken, you utilise narrative therapy in your private practice. Can you explain what that is exactly?
Okay. Well, Jane, I think when anybody comes to speak with me, they bring in a story. And it's a story about themselves, it's a story about others, it's a story about life experiences. And narrative therapy says that this story is actually forever changing. So if you think of the idea that if something happens to you and you go and share that with a friend, the dynamics of it, the interpretations of it, and after that you go to another friend, and again you share the story with that friend, and then another friend. Those stories won't actually be the same. So you can never ever have the same exact story being told. So when a client comes to see me, usually they bring in a fairly, what I would call a dominant, rigid, repetitive story. And it's a story around a struggle. It's a story about that they just can't achieve or solve a particular issue. And the narrative therapy tries to loosen the story and create more possibilities. And how this is done is that you start between the sentences or between the sort of description or the interpretation, you start opening up some new perspectives in the conversation. So it's a conversational mode of therapy, but it's also very sensitive to a couple of characteristics. The one is it's got to be a safe emotional space, because we can't tell private stories that we struggle with if we don't feel safe to reveal what we want to say. It also has to be a respectful space so that the person sharing the story doesn't feel judged or there's no criticism. And the other thing is, it's got to be a space where, as a therapist, you're not the expert. You are actually a co-creator with a new story with the client that basically starts emerging in the therapy process. So that's the essence of narrative therapy. And I think, every word doesn't have the exact same meaning for everybody. Every sentence that we say, and as we join two sentences up, might have a different interpretation to different people. And so as a therapist, I speak between the words. If you think about, I ask questions that expands the space between the sentences so that we could add new perspective, that we could add new meaning, and that we could sort of add more hope and optimism to the experience of what the client's going through. And I often say to clients that they are authors of their story. So they are telling whoever from their perspective, but they've also got the power to change that, to reinterpret things, to take a different perspective on the experience in it. And in the story, I also say that you've got half the pen to write your story. Life has got the other half. So there's this interaction between life and ourselves, and the evolving story that we tell ourselves and we experience.
I think it's very interesting because I've had therapy at different points in my life, and definitely the first time that I saw a therapist, I went in with a very clear idea of what I wanted to tell her and how I wanted to tell it, and I planned it, and then I very quickly realized that therapy doesn't work like that.
Mm-hmm. I think what you say is so interesting, because even as a therapist, in my early years as a therapist, I suppose one would want to try and strategize, or one would want to have an idea about how the therapeutic process should unfold and what change should be. And I soon learned that even as a therapist, we don't have a plan. So we have to be very open-ended on one level. We have to be very present. And we have to be curious about the reality that's unfolding and the newness, because there's constant newness in our words and in our perspective and so on. And once we do that and we start shaping the new understanding, what is so interesting is that you then cannot see the problem in the old way. It's like you've seen it in a slightly different way, and this is it's a freeing element of therapy. One feels relieved. One feels also that you've been heard. So a story needs to be heard, and I think coming back to what I said about it being a respectful, safe space, is that as a therapist, I want to really hear and not preempt and think I actually fully understand the story. Because stories are so complex, and they become more intriguing when you take time and you start really thinking about what has been said here. The other thing that's hitting me now as I'm speaking about stories and that is that in therapy, there's often a lot unsaid in a person's life that also can't be said. So the therapy allows the unsaid to be revealed, and it also acknowledges the yet to be said. And the yet to be said is the new reauthoring of a new perspective in terms of the struggle that the person might be having.
Can you use a family systems approach to therapy as well? Can you talk a little bit about what that is exactly, and about the ecology of ideas that exist within a family?
Jane, I think this is linked to what we were talking about earlier on in terms of the stories and the interpretations that families, or when I say families, I'm talking about mothers and fathers in the family predominantly, because they are the main custodians of ideas, and then the children pick up ideas from the parents. But the ecology of ideas is the information that exists in the family, and it's the knowledge, it's the assumptions, it's the beliefs around, for example, finance, or around bringing up children, or in terms of how do we relate to other families or to community. So there's a diversity of ideas that exist in a family. And if you look at the family system, the ideas are often brought from previous generations. In other words, what your father and mother, for example, has shared with you as a child. I mean, from a more personal perspective, I remember my father saying to me, healthy body, healthy mind. And he encouraged a lot of sports. So I've got a younger brother, just the two of us, and we played cricket, and we played football, and we played any sport, and we were very active in terms of the physical side and the sporting side. And as a child, I actually thought that this was how it was. This is how families operated. Until, you go to a friend's house and then you see the father just sitting there on the chair, and he might be overweight and he's drinking a beer and he's smoking a cigarette and so on, which my father didn't do and wasn't like it. So you quickly understand that families are unique in terms of the ideas they have about all things. The thing about having a child in a family is often the parents cannot actually compare how this child is to other children, because they can only assess the child within their own family. So they wouldn't know if this child is bright or not, or whether this child is struggling, or whether this child is too aggressive or too talkative, because they've got no real comparison. They might go to other families and then they might see another child and then they see their own child and then they might start concerning themselves. Like, for example, they might see another child who's more outgoing and goes out to play alone, and their child is hanging around their legs and doesn't want to move away from them to go and play, for example. And when they start seeing this difference, they might then start feeling, hold on, our child shouldn't be like this, or that the way we have been sharing some ideas, because the idea might be that the world is a place that you need to be afraid of, and without knowing it, they're passing it on to the children. Not actually saying it, but because there's a lot unsaid. It's more the way you interact, it's more the way you respond that gives the child this message about that this world might be an unsafe place, for example. So the ecology of ideas in each family is very unique. There's no one family that's the same in terms of how they're thinking about anything. And I think as a family therapist or narrative therapist, I get into the psychology, this ecology of ideas. I look at the diversity. I look at why the father and the mother are joining these two ideas together, where they could join up another idea with this one idea, and just joining up those two can give you a different perspective of what they do.
You touched a little bit there on parents seeing children, comparing their children with other children from other families, and being able to see a difference between children. So I want to move on a little bit from there and ask you, what reasons might children develop emotional struggles? And also, how do parents know when to ask for professional help if they see that, or they feel that there's a difference between their children and other children? At what point do they know, yeah, actually we should go and talk to a professional about this?
Mm-hmm. If I get to your first question about what causes children problems or the emotional problems for children, maybe I can share a story of a little girl. She was about 10 years old, who was referred to me many years ago. I'm talking about sort of 5-6 years ago, before I relocated to Germany. And this little girl was suffering from severe heartburn, to the extent that she couldn't stay in class. She had to be excused because of the pain that she was experiencing in her heart. And she'd been to 3 or 4 doctors and cardiologists, and she'd had all these different tests. And nothing came out as that there was a problem with her heart. And after a while, the doctor actually suggested that the family and her come and see me. And so I met the family, or the father and the mother, and this young girl for the first session. We spoke a little bit about the impact of what was happening and so on. But there was a lot of tension in the room. And in this conversation, they shared with me that they were going through a divorce process. So we had these two parents and the little girl with a lot of tension. Anyway, I suggested to the parents that let me just speak with the little girl alone for our next meeting. She came in and we spoke about her heartburn and she had such pain. She was actually sitting there at times just like this. So sort of back to this conversation spontaneously. I don't know why I asked. I said, "Can you draw this for me?" She said yes. It was almost like immediate. So I brought out my crayons and I brought out paper, and she drew this very big heart, and it was torn in between. And there were tears coming out this heart, and it was such a sad image. And I said, "Can you tell me a story around this?" And she said, yes. She said, "On the one side is my mom, and the one side is my daddy. And what my mommy and daddy do is when I'm with my daddy, they tell me how bad my mommy is. And when I'm with my mommy, she tells me how bad my daddy is. And I'm feeling so torn because I love both my mommy and my daddy." And we had 2 or 3 sessions like this, asking her again, does she want to add to the picture and so on. And after 3 meetings, the heartburn disappeared completely. And it sort of gave me this idea that she had this space that also again to share through this drawing her intense emotional struggle that she was having in the family. So that's one of, let's say, why a child might develop an emotional issue. Children are very sensitive instruments to the family dynamic. So if there's an issue between father and mother, the child might reveal that. If the father is, for example, going through a particular issue, so another example of this, many years ago, I saw a family with a child that kept on lying about anything, everything. And after a lot of speaking to the father line and mother line, the father revealed a secret that he kept on lying about. And once we dealt with that on the parental issue, the amount of lying from the child reduced. But the problem here, the issue here, is if that continued over time, the lying would have probably become a pattern for the child, and the child would have probably taken that into adult life. And so one wants to sort of reduce that. So yes, the thing about the second question was related to, now I've forgotten the second question, but it was related.
How do parents know when to ask for professional help with their children?
Okay, I think if the problem is dominant, in other words, in the family, 95% or 90% of the time is dedicated to trying to resolve this problem with the kid. So the kid is taking a lot of energy and attention in the family around this problem. So that's linked to the intensity of the problem. I think frequency. In other words, if the child every second day has a stomach ache, okay, so it continues, I think that's another indication. And then also the last one might be is if there's a change in the child's behavior. So the child normally is very quiet and suddenly now becomes boisterous and it's not the normal way that the parents have experienced the child. So that those would be the 3 indications: the intensity or the sort of dominance of the issue in the family all the time, the frequency of it, and then, for example, there's this idea that the child gets stuck in it. It's sort of like the family gets stuck in it. So those might be indications. Yeah.
Ken, we're coming to an end now. It's been fascinating listening to you this morning. I feel that I've really learned a lot from you talking about psychology. If our audience would like to get in contact with you, I'm going to put your website address at the bottom of the screen now. And people can take a look at your services there, find out more information about you, and they will find your contact details, your email address and phone number. So thank you very much for joining me today, Ken.
Yeah, thank you very much, Jane, and thank you very much for this conversation.
My pleasure.